this blending palpation. Just keep steady pressure in there and let your thumbs, because when you first put pressure on there, light pressure, it feels like this area is actually rotated to the right. But if I keep steady pressure on my thumbs, the muscles on the right relax and my right thumb just goes further and further anterior. So that thing is really rotated to the left. See, so the muscles can play games with you. So then remember we said we want to use translation. So if we say to the patient, now sit up good and straight, stomach forward, shoulders back, and head back. And then I want to glide him forward and back to get that vertebra right at the apex of the curve. Why? Because then he can show me his stuff the best. And when he does that, my left thumb comes way back, my right thumb feels like it's going forward, feels like my right thumb's going up and my left thumb is coming back. So what's happening in terms of the facets then when I do that? So the left pair's closing, the right pair won't close. Okay? So, and you see the asymmetry and extension, so it means it's not an extended dysfunction, it's a flex dysfunction. So you name it by, and see, we're always naming basically what it can do. The positional diagnosis is what position it's the most happy in. Okay. So that comes back when he does that. Now let's have you slump forward. And when he slumps forward, I want you to also lean back towards me. And when he does that, it's very interesting. My left thumb comes back again. What does that say the facets are doing? When you bend forward, the facet should be opening, right? And when he bends forward, the left thumb comes back and drops down. The right thumb feels like it's going anterior to cephalad. What is that? So it's the right pair is opening, the left pair isn't. Now, think about it. This is where terminology can get you in trouble. Because you say, I can't wrap my head around it. How could it be flexed and extended? It doesn't make any sense. But if I say, wait a minute, just forget that, and what are the facets doing? His left pair won't open with flexion. His right pair won't extend with close with extension. Then it makes perfect sense. Okay? And lots of times, ask yourself which one do you get the most rotation with? Because usually if you treat that, you get both of them. So I think lots of times the second one is the body trying to adapt to the first one at that level. And it's part of its compensation thing. So lots of times, don't be surprised if you find what appears to be two dysfunctions at the same level. Okay? Now, with our patient here, it seems like, see, that's probably about 5. So it feels like I get more rotation when he extends than when he flexes. So that's going to be the position I want him in, is extension. Okay? Now, one of the things I think was Stiles' genius was that he never wrote a technique manual. Okay? And I think what he was saying to all his students was, learn the principles I'm working with, then learn how to apply those, but don't mimic what I'm doing. Because you may be a different size or shape than I am. The patient may be a different size and shape than the one I'm demonstrating on. So then learn the principle, then you can get it to work for you. So how would that work? So if I want to treat that with muscle energy, I could get on this side and I could say, and let the patient do most of the work. What's neat is you get paid for it. Because let me try something else here. Sit up straight again. Now what I want you to do is just flex your head forward as far as you can. And everything is symmetrical. Bring your head back as far as you can. Everything is symmetrical. Because I didn't use translation. Okay? But if I say to him, now push your stomach forward and bring your shoulders back and head, and right at the end, man, that thing comes flying around to the left. See, so if I hadn't used translation, I would have missed this bugger. So that could be one of those minimal dysfunctions that's raising havoc in that system. Okay? So then I could get him into extension, see, and I could reach around him like this. I could also use the head and see, because Mitchell was doing sequencing, he could use the head lots of times because that wasn't the key area. Now, if the neck was more restricted than the cervical area, you try to use the neck, the patient's going to fight you. Okay? But people, and so that's why a lot of people use these techniques, reaching around like this or doing this, because they say, and a lot of people, it riles up the neck. Yeah, they didn't realize that sequencing was important to Mitchell. Okay. So I could do it from that side, but look, I could do it from this side. See, and then I think, yeah, with his size and shape and my size and shape, I think, man, I like this. Because I've got good control, I've got him resting against me, and feel the difference when I get away. He's supporting, but if I let him rest against me, he can just relax. Now push your stomach forward just a little more right there. That's the extension, see. Now, when I side bend him, see, I can use my hand to glide him towards me. See, and that'd be translating him to the left. And when I do that, he automatically rotated down to that. Now watch. If I get him at that same point and just side bend him there, I don't get the rotation. You feel the difference when I do that? So always use, seeing how I could translate him is allow him to just bring him with me like that. See, as soon as I did that, he ended up at ERS to the left, right, where I want him. Then just make it just a little doodad push to the left. There you go. See, now, when you're holding, say, a head to have him push, if you got a Vulcan mind hold grip on that head, what's the message the patient gets? You're expecting him to push hard. But if you just put like a finger there and say, now just resist the pressure of my finger on your head, see, then you get the right amount. See, and that's all they need. Then relax. See, and then fiddle and diddle to fine tune that. And what am I doing? I'm feeling everything move right at that facet. I want everything localized there. Now push again. And relax. 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 There. Now push again. Okay. Now, keep your hand there so people don't think you're moving. Now, sit up, good and straight, stomach forward, shoulders back. See, and when he does that now, that's symmetrical. Now slump down, and when he does it, everything's symmetrical. So we know we got both of them. So then we say, okay, looks like we picked the right treatment, we performed the treatment well, and we changed both sides, both pairs of facets by doing that. Okay. Any question on what we're doing there?